interesting topics. I'm really happy to say. I always say thank you to my viewers who leave these comments or questions on the channel. Very much appreciate you. So we're tackling left-sided abdominal pain. We're looking at Depo-Provera side effects. We're talking about fibroid treatment and fertility around the world. So it's not just this is wait. Let me when we get there. Let me just give you guys something to anticipate but when we get there, because I'm so excited about this particular conversation. And finally, we'll be talking about genital warts and low CD4 counts. So there is a lot that we have to show today. So thank you. Where are you watching from? How are you doing? How has your weekend been? If you've got any questions, always very welcome, either on the live or in the replay. Pop them in the comment section or after the video. If you've got any questions around the things that we talk about, you know that I'm going to have a look at them. And it may be that your question is the one that we pick for the week. So please feel free to pop them in. All right, guys, so let us begin. Before we do that, though, let me not forget, let's not forget our usual process. We have to put a disclaimer. So yes, we're here to discuss health information and health education. We're not giving advice on any specific situation. I'm sorry if that's disappointing to you, but let me explain to you why. I'm not your medical provider. I cannot do that online in terms of a social media platform. We cannot use that medium to diagnose or provide treatment. But what we can do is talk about health information, discuss symptoms, discuss medical jargon, discuss misinformation and misconceptions and so on. We can do all that. And we do so to educate ourselves, to know more about our bodies, and then to suggest ways that you can go back and discuss with your doctor. So that is what I'm really very much interested in. So I hope this is of value to whoever is watching, whether it's now live or in the replay. All right, with that out of the way, let us just pop straight into the very first question. I'm going to share it on my screen so that you can read it along with me. And it's an abdominal let's see if I can get it up on the screen. Yeah, so it's an abdominal pain question. It's actually in response to a video I did not too long ago on ovarian cysts. So after watching the video, and shout out, thank you so much to the person who sent in this question. After watching the video, she wanted to know, will this pain be like below the rib? Because last year I had pain on my left side below the rib or like in my rib, and I felt nauseous. It made me cry out at one point. So I went to the walk-in center. They said ectopic pregnancy. They did a test and it wasn't. The pain subsided anyways, and that was it. So she really just wants to know whether this pain that she experienced not too long ago could have been an ovarian cyst. So I thought it was an interesting question. I said, okay, let's tackle this. Let's have a look at the considerations here. So I'm just going to share my screen so we can have a nice photo of the abdomen and pelvis, because I think that's what will help us make sense of what could possibly be causing pain on the left side of the abdomen, and if it could be an ovarian cyst. So that's the question that we're trying to tackle. If you're watching, guys, please don't forget to give the video a like. It will be very much appreciated. I can't tell you how much it really helps us and helps YouTube to know that we're doing something really useful here, and that you're finding value. So giving the video a like doesn't cost anything. It is just simply pushing that thumbs up button, and it's very much appreciated. So let me share my screen here, and hopefully you can see an image of the abdomen and the pelvis, the female abdomen and the pelvis. I'm going to go through, while you're looking at that, I'm going to go through what are the things that we should be thinking about, what are the things that's in the back of our heads, and then I'll come back and I'll go through the image itself, the drawing itself, so that you know from top to bottom what are the different organs. So the key thing here that we want to take away is the different possible causes of pain in the upper part of the abdomen, okay? And importance of not missing out some things. I'm really glad she mentioned ectopic pregnancy, and I'll explain why. And I think it's also good because the pain went away, and you may have been in that similar position where you developed some type of pain, you had to rush to the hospital, you got there, they gave you this, they gave you that, and the pain suddenly went away, and they couldn't give you any answers. They couldn't say exactly what was the problem. They knew it wasn't this and it wasn't that, it wasn't that and it wasn't the other. Okay, but what was it then? well, they don't know. And then they said, okay, well, now that the pain has gone, you're fine, off you go. So you're feeling better. But you think, wow, I would have really loved to know what caused that problem. If you've been there, put your hands up in the comment section, let me know. But of course, I totally understand. It's something that's pretty common. But so let's give a shot at trying to unravel the cause of this pain that gave this kind of dramatic presentation that was really bad enough to make her cry, made her feel sick and so on, but it had no answers. And then, of course, we'll talk about what we call red flag symptoms. So thank you so much for sharing this question again. Clearly a very frightening and painful experience. I think it was absolutely correct for you to take yourself straight off to get medical attention. So whether at the walk-in center or the emergency room, whichever you can get to, given the severity of the pain, I think A&E or the emergency department is the right place to go. So let's look at what could have been going on. So this is severe pain in the upper part of the abdomen that is associated with nausea. So nausea means the feeling of wanting to vomit, the sensation that you feel you're going to throw up, that, really awful sensation that pregnant women in the first trimester many pregnant women in the first trimester will be very, very familiar. So let's just dive into why they thought about a pregnancy. Because if you're looking at the screen with me, I'm now looking at the image I'm sharing with you. Right from the top part of this screen, we're going to go from left to right. So you see the purple haze or the purple circular shadow on the image, and that is around the area where she had the pain, because she said she felt it around the left rib. So I'm looking at sort of the possible highest part. Now the stomach is slightly cut off. The stomach is that organ next, so hopefully you can see my little indicator here, but the stomach is sort of slightly cut off, but that's your tummy, that's the stomach. And as you go more towards the right, you're entering the territory of the liver. Now the organ that you can't see because it's sort of sitting behind these organs is the pancreas. So it goes across, and so sitting behind the liver and the stomach. This is the organ that is responsible for really important things. One of the things that it's responsible for is production of insulin, but you can't see it on this picture. It's sort of behind those other organs. And this cute little, would I call it cute, this green balloon-like thing you can see underneath the liver. I don't know if you can guess what it is, but 20 points if you said it's the gallbladder. So that's the gallbladder here. So these are the organs and the things that I would expect to cause pain. Oops, let me stop that. That I would expect to cause pain if you said, oh, I'm getting pain in the upper part of my abdomen. If you said it's on the left side, then I start to think, oh, what are these organs that are close to the left side? So I'll be thinking about the stomach. The other thing that is hidden in this picture that you can't see and sort of hanging around behind the stomach, those of you with sharp eyes may be able to see the shadow here. There's the spleen. The spleen is that organ there. It's in brown, just hiding behind, underneath the ribs and behind the stomach. So if you've got sharp eyes, you can see it. So those are sort of the organs. And of course, you also have things like the blood vessels. They're behind there. You have muscles. Those are things that we can't see on this image, but there's a lot that could potentially cause problems. Let's work our way downwards, still on the left-hand side. So we have this big sort of rubber-like tube that you can see there. Of course, from your biology in school, that's the big bowel, and it travels downwards on both sides. So you've got the big bowel going down here on the right side, going down here on the left side, and eventually it's going to go behind all this way to get to form the rectum and then the anus. And then you have the little smaller tubes inside, and this is the small intestine or the small bowel. So we're working our way down, and I particularly want you to focus, because this is the image of a woman. I particularly want you to focus on the reproductive organs. So you have the womb here, with these two protrusions to the edge, to both ends are the ovaries. So the one that's highlighted in yellow here is the left ovary, and I've highlighted that because I'm thinking, okay, if it's a left ovarian cyst, how on earth is it going to cause pain on the left side underneath the rib? And that's why it's highlighted, because that's the connection. That's why we're looking at this review. But just to finish the anatomy, to make sure that we sort of cover the entire image, we've got the womb here, and in front of the womb is the bladder. here, okay, and this is the pelvis. So looking at the bones now, this is the pelvic girdle. These are your thigh bones here, your hip joints and your thigh bones going down. And of course, alongside all this, you will have muscle, you have other tissues. So really important. So, but the first thing that she said, okay, if you remember the comment, is that they did a test for an ectopic pregnancy. So why? She's coming with pain in the upper part of her abdomen, and the first thing they say, oh, let's check if you're pregnant. Sounds weird. Well, so she said she felt sick, and they wanted to check that because it's a standard practice. Ectopic pregnancy is such an important condition that you don't want to miss. It's a standard practice that in any woman of reproductive or childbearing age who comes in with abdominal pain, regardless of the location. And I'm going to explain to you why. Regardless of whether she says, oh, the pain is at the top here or it's there, you want to make sure that she's not pregnant, okay? So that is why they did an ectopic pregnancy, and it wasn't a big jump. It's a standard policy that we practice in the emergency rooms, in the walk-in centers, in the urgent care centers. You come in with severe pain, we think that you're in the right age group to be pregnant. We will definitely get a urine sample of you and check that you are not pregnant, so that we do not make a mistake of missing that condition, because of course it can potentially be life-threatening. So it wasn't an ectopic. What else could cause her to have such intense pain? Right, I've shared with you the things, the organs that are within this area, and one that should jump out straight to you is the stomach, okay? So we call them gastrointestinal conditions, and they could range from different things. So they could be problems affecting the stomach, problems affecting the small bowel, problems affecting the big bowel, and all of these could cause problems. One very common one is something called diverticulitis. Now, it tends to happen more commonly in the lower left abdomen, where it affects the big bowel on the left side, but it can sometimes develop or happen on the upper left. And it's an inflammation or even an infection of small pouches that are present in the big bowel or the colon, okay? So that's diverticulitis. It could be one cause of this pain that she had. It seems unlikely given the fact that the pain settled and didn't come back again, otherwise she would have said so, but this is one possible cause. The next, of course, is something that affects the stomach itself. So this is what we call a gastritis, which is an inflammation. Anything itis is an inflammation. Gastritis is inflammation of the stomach, which could be for so many different reasons. You've eaten something that doesn't agree with you, or you've taken, you suffer with excess acid, for example. You could get reflux pain that we commonly refer to as heartburn. So you could develop gastritis or even a peptic ulcer. These are conditions that affect the stomach, where there's inflammation of the stomach lining, and what you experience is a burning pain or a gnawing pain, like somebody is boring into your side. You can actually feel that all across the upper part of the tummy. Most commonly, of course, you might feel it in the center, but you could, because you can see how the stomach is moving, lying towards the left. Okay, you can see that the stomach crosses from the left all the way, even past the middle. So you can see that that pain could also, show up on the left-hand side. So that could very well be what it was that she had that was causing her to experience that pain, and it will definitely make you feel sick. In fact, just the fact that the pain is severe is enough to make you feel sick. The other thing that could cause a severe pain that will make you feel so ill, a grown adult burst into tears, is pancreatitis. So do you remember I mentioned the pancreas? It sits behind the stomach, so that's why you can't see it on this picture, on this image. But if it's inflamed or infected, it can cause a severe, persistent upper abdominal pain, and it is one of those conditions that is associated with nausea and vomiting, and something that you'll be properly ill. We'll usually admit people for that, to have blood tests done, look at rehydrating them, trying to do investigations to find out what's happening. But yes, pancreatitis is another possible cause. What else could make you so uncomfortable, cause pain on that side? What else are we missing? Any other organ? I mean, we haven't talked much about the liver. It's on the right hand side, and so I would expect a pain from the liver or the gallbladder to sort of be more on the right hand side and maybe crossing towards the middle. But there's something called referred pain. Referred pain means that a pain that starts or originates in one particular area can travel elsewhere, and sometimes it's traveling because of pressure against other organs or because of nerves that these organs share. So that's why you might find pain where it's being caused by the liver, but it's now coming towards the center or even around the umbilical side, because far from where the organ, the liver itself is. So it's not out of this world to sometimes have pain that is from gallbladder problem or liver problem, and the person is saying, oh, the pain is around my belly button, oh, the pain is just here. And they can't really be specific until you try to examine, and then you find, oh, the maximum location of the pain or the maximum area of pain is around that liver area, or when you do tests or do scans and you realize, okay, it's actually coming from the liver. But I digress. There's another problem that could result in this kind of severe pain that seems fairly ordinary, and that is severe constipation or gas. Now, don't get me wrong, let's not underestimate constipation. I've been caught out by constipation before. I saw this a very long time ago. I saw a lady with a very bloated tummy, and she had been that way for 2 or 3 days, and I was ready to bet my next salary that she probably had some kind of serious liver condition that had caused her to develop fluid in her abdomen. Of course, I referred her urgently to the specialist. And then by the next time I came on shift to find out, to check, oh, how is this lady doing? Because she was in so much pain. She couldn't sit, she couldn't stand, she was in tears. It was crazy. And when I came back to have a look at, oh, what's happened, I was prepared for one of the, really, really serious, intense diagnoses. It was severe constipation. What? I thought, wow. Because the degree of discomfort, the degree of pain that she had, I thought, wow. And from that point, I learned never ever to underestimate even the so-called constipation, because it can cause such discomfort. Okay, it can also cause trapped gas. I think that's part of the problem. So if somebody hasn't opened their bowels for several days, maybe because their diet has changed or they're taking some medication that can cause constipation as a side effect, this is what might result and happen to them. So I don't underestimate it. Could it cause pain in the upper part? Well, because you're bunged up, because you're blocked up, there's feces, and I'm sorry this sounds unpleasant, but just as a way of describing, because your bowel is blocked up, it might trap gas in the upper part of the bowel, and both the large bowel and the small bowel, which can cause pain. And yes, that pain could happen in the upper part of your abdomen on the left or the right side. So if you're just joining, guys, welcome. We're talking about possible causes of left upper abdominal pain, and this is based on somebody who watched a video where I shared possible signs of an ovarian cyst or a burst ovarian cyst. And what I would typically expect for somebody with a burst ovarian cyst would be pain that is around the lower part of the abdomen or pelvis, but we're going to get to that point. So we've dealt with some examples of this problem happening because of a gastric or intestinal problem. But don't forget that you also have muscle. It's not showing here on this image, but you can have muscle and skeletal causes. So if you've got a pulled or strained muscle along the rib cage because you have muscles in between the ribs, okay, that can cause a sharp stabbing pain that feels like it is in the rib, especially with movement, or if you're taking deep breaths, that can make that pain worse. So that's something else that could be responsible for the pain that she described that she had. Now, something else that's interesting, I'm sure that if you're watching this and you've experienced this, you'll probably be shouting this out to me, is a kidney stone. Who thought of kidney stone? So if you've had a kidney stone, nobody needs to explain it to you. It is one of the most horrendous types of pain. You can't do anything with yourself. Really severe pain, a stone in the kidney, that small organ, and this stone is going to try to make its way out of the kidney into the very tiny tubes. Now, of course, you can't see the kidney here because I'm showing you the front of the body, but you've got the kidneys on either side, so just lying behind the rib cage or underneath, slightly behind and underneath the rib cage on both sides. And the kidney tubes, the ureters, I beg your pardon, are traveling down from each kidney as they travel towards the bladder. So if a stone is trying to make its way from the kidney into the tube, the pain is horrendous. It is definitely associated with nausea and vomiting. It's a severe flank pain on the side, and that can travel around to the front because of this thing I mentioned earlier, referred pain. Okay, so that's why when your doctor is examining you, they're examining the entire abdomen, they'll examine the back, because we are conscious that the pain might start from one particular location, but it could migrate to somewhere else simply because of this process, either pressure on the other organs or being referred to another part of the body. So like I said, nausea is very, very common. I mentioned the spleen, which you can't see very clearly on this picture, but if you've got sharp eagle eyes, yes, you can see the spleen just lurking behind the stomach. So it's not very common, but people with sickle cell disease may have what we call infarcts in that area, in that organ, because the sickle cells are blocking the blood vessels, so that can cause severe pain as well in such cases, or if there is a cyst going on. All right, so these are some examples of pain that can happen in the upper parts of the abdomen and how they can develop and how it's related to where the organ causing the pain is located. So any pain that is severe enough to make you cry, as in the person who posted this to us, that is sudden, it just suddenly starts, it's intense, and then there are also other symptoms alongside, like a fever, nausea, you're vomiting, it's not stopping, or you're feeling faint, dizzy, that warrants an urgent trip to the doctor, to the emergency room, to work out what's going on. So the fact that your pain settled down to my poster of this question is reassuring for a one-off. I think if it happens again, don't sit down on this. We need to work out what's causing this. So if it happens again, and touch wood, it doesn't, but if it does, hopefully this time around they're going to be doing some more tests to work out what it is. If it settles down again, then you may need to go and sit down with your doctor and say, okay, perhaps we need to sort of look a bit broader, think outside the box, what else could be going on that they haven't picked up in the emergency department, to work out what is going on. So finally, let me touch the possibility of an ovarian cyst causing this pain in the left upper side or left upper side of the abdomen underneath the ribs. Is it possible? Is it possible? So I showed you the ovaries again. They're in this location within the lower abdomen / pelvis on either side of the womb, all the way down is where they are located. So I would expect the pain from an ovarian cyst to be sort of located lower abdomen and pelvis, because it's rising from the pelvic area. Okay, and the only chances where such a thing might happen, because you don't say never or impossible in medicine most of the time. So even though it's unlikely, because the ovaries are seated within the pelvis on either side of the womb, and if they're going to do anything in the abdomen, it's the lower abdomen that will happen. But what if it's a very, very large cyst that's been growing, and it's grown so large? Some could do that. And at the time that it's grown so large and it bursts, it's quite close to the upper part of the abdomen. So yes, of course, that's the possibility. How common is it? Not very common. Like I said, ovarian problems, diseases, or pathology usually will be sort of pelvic and lower abdominal problem, but it's good to understand that it's possible, that it could happen if it grows to such a large extent. The only way that we could know for certain, of course, is if we do a scan, and that is something that, of course, the people that are looking after you, depending on the complaints that you give, or depending on the symptoms that you present with, will want to do. So thank you so much. Let's see the question again and see if we've tackled it with any bit of reason. Somebody says, so the question says, will this be pain like below the rib? Last year, I had pain on my left side below the rib, or like in my rib, and felt nauseous. Made me cry out at one point. So we went to the walk-in center and they said ectopic pregnancy. Did a test and it wasn't. The pain subsided anyways. So that is the explanation of this mysterious left-sided pain. We don't know, and we've talked about the possibilities, and we've said, if it happens again, don't sit on it, let them check it over. Okay, so thank you so much to guys who are watching. Good to see you. So we've got a comment where somebody says, hi, Shafiq, who's saying, how do you treat hemorrhoids? Hello, Shafiq, where are you watching from? And the True African Cinderella. Ooh, I love that name. Hi, good evening. Welcome. How are you doing? Where are you watching from? And we have Dina, my fave location. Okay, where is that? Dina, tell us. Don't keep it all to yourself. Anyway, thank you so much, guys, for joining. I hope you're all doing well. What questions do you have around these topics that we're talking about today? Let me know if you have any thoughts on the ones that we're discussing. And let's move on to the very next one. So this is another interesting one, okay? I said that we're going to be talking about left abdominal pain, Depo-Provera, fibroid treatment and fertility. So let's go on to talk about Depo-Provera side effects. And again, this was a question. Let me see if I've got the right one. Let me see if I can pull it up here. Where is the Depo-Provera? Yeah, that's the question. So let me pull it up for you here. Where's it gone? It's gone off again. I had it here and it's, yeah, okay. So this is the question. And thank you so much to, was it Dreamer? I think it was Dreamer who sent in this question. I hope I've got the name right. If I haven't, I'm so sorry. Well, thank you so much. I tend not to put the questions, the names up actually, because, you know, I just want to make sure that we maintain some kind of privacy. But to everyone and anyone who posting questions, always much appreciated. So guys, you've got the question shown up on your screen and it says, I'm in my early 30s. I had a 3-month Depo injection. This is my second time having the injections, i.e. I've had them 6 months in a row. My first time experience, I felt dizzy when about to have my period. The second time I felt dizzy, and this time the dizziness continued till the end of the period. Within the 3 months, I only had my period for 1 whole month. That is 1 month out of the 3 months. I think the dizziness is caused by blood clotting. Please, I want to know if this is normal. Okay, so this is the question. She's on the Depo shot. She's had 2 injections every 3 months. So she's had 6 months worth of injection is what she's saying to us. And she wants to know, I'm having these problems. I'm experiencing dizziness. I went a whole month bleeding. And then she's worried about blood clots. So a few things that she's obviously concerned about. And I can totally understand and appreciate those concerns. So let's talk about the Depo shot. I do have a couple of, well, more than a couple actually, videos on the channel where we talk about the Depo shot and its side effects, both the common ones, the more serious ones. We talk about how the injection, the particular hormones behind it work. So let's look at the the concerns. So thank you so much for this question, this important question. Oh, it's 1010. I found your name. Thank you for this question. So there are 2 very common experiences with the Depo shot that you're describing for us here to look at here. I think everybody has been able to see the question. So let me pull it away. So thank you so much for this question that you provided to us. I think you're describing 2 very common experiences for somebody who's using the Depo. That includes the irregular bleeding and the dizziness that could happen. But you've also linked them to something else that's quite serious, even though it's less common, risk of a blood clot. So let's look into all of these things. So first, let's talk about the bleeding. And it's one of the things that I would expect that whoever is prescribing this injection and, giving you this injection, or, whichever way it's going, would explain to you in terms of what to expect. But in spite of what they've explained, I think they would also have told you that you can expect it to be irregular. So they may say, oh, it may be heavy, you may be spotting, you might have bleeding in between your periods. But the truth is, nobody can tell you exactly what experience you will have until you start using the injection. So bleeding, which as you've described for a whole month, unfortunately, is not an unusual side effect. It's typical, especially when you first started, the first sort of 6 to 12 months. For many ladies, their bleeding pattern just goes haywire. Okay, so why does this happen? Depo contains progestin, a big amount of this hormone. And so what it does, it's obviously is going to stop you from ovulating, make your ovaries go to sleep. So your own natural hormones temporarily go to sleep. And then it's going to thin the lining of the womb. So because the womb lining is thin and it's not very stable, there will be unpredictable bleeding. This is the irregular periods that you would have. So you may have bleeding for a prolonged period of time or bleeding at times that you don't expect, okay? For many women, what happens is that it does settle down. That's what tends to happen. And so sometimes for those of us listening who are using the injection, perhaps if you're just new at it and you're wondering, oh, why would my doctor just stop this injection? Sometimes because we know from research that after you've been on it for, say, 6 months or a year, it does settle down. So if this method, if you like the method and the bleeding is not horrendous, it's not a distressing amount, and it's not too it doesn't mess up your schedule to a great extent, it's not unbearable, you may be encouraged to try and, stick it out. But I would say if it is causing you serious problems, then please, have a chat with your doctor. You don't have to stay and suffer because we said, oh, just bear it for 6 or 12 months. Please have that conversation. Okay, so for some women, it settles. For others, it doesn't. It can be persistent. Prolonged bleeding, though, can be quite serious. Okay, so it's not something to just endure if it's severely affecting your life. All right, so let's talk about dizziness. Okay, you mentioned dizziness. You also mentioned blood clots. Let's go with the blood clots first, actually. Let's just sort of, talk about that. So blood clots are a recognized feature for a number of things. One, pregnancy, being pregnant itself increases a woman's risk of having a blood clot. From the time she falls pregnant up to 6 weeks after she's had a baby, there's an increased risk of developing a blood clot. That risk is a lot higher compared to the risk of using a hormonal birth control method like the combined pill. That is the pill that contains estrogen and progesterone. So I know many people will go away and say, oh, the combined pill, the combined birth control pill, it can cause you to have blood clots, it can do this and the other. And yes, there is an increased risk. I agree. I'm not going to, fudge that. Of course, that is the evidence, and it's important that you know that. However, did you realize that you actually are experiencing a less or a lower risk if you're taking the pill, the combined pill, compared to if you were pregnant? And so by trying to prevent an unplanned pregnancy, say you're not, prepared for pregnancy, you're actually getting more protection, if you like, by using the pill compared to if you were pregnant. I hope that makes sense. So that's with the combined pill or the patch or the ring. However, progesterone or progestin containing hormones or methods like the injection, like the coil, the Mirena coil, the can't get the words out, the intrauterine device that contain only progestin. According to research, and this is supported by the UK College of Sexual and Reproductive Healthcare, American College of Obstetricians and Gynecologists, progestin-only methods like the shot are not associated with an increased risk of clots. We haven't seen a direct cause. Even though there are studies that make suggestions, there hasn't been a direct cause between these progestin-only methods and blood clots. So the likelihood that what you're experiencing, this dizziness, is caused by the clot from this medicine is very low. Okay, so I wanted to get that out of the way because you're worried about the blood clot. And again, I would encourage you to go and have a conversation with your prescriber about any things that you're worried about so that they can put your mind at ease. They know your medical background. There's no point me saying all this and not knowing whether you also have other conditions that could put you at risk of a clot. So that's why I always say we don't give specific medical advice. We use the questions, the comments to help educate ourselves. Okay, so back to the question, what is making her dizzy? What could be making her dizzy? So there are a few things in terms of the picture that she's giving us. And don't forget, the picture she's giving us is very limited. Now, the progestin that she's taking, and she's taking quite a big amount that is in this injection, can cause fluid retention or bloating, okay, which could affect the blood pressure and potentially make her feel lightheaded or dizzy, okay? The other reason, which is probably the first reason that you think about, is she's losing quite a lot of blood. She told us that she bled for an entire month. She didn't tell us how much or how heavy that bleeding was. So it's possible that she could be anemic. I think that's very critical. I think that if you've been experiencing prolonged bleeding for a whole month, of course, you could be becoming anemic. So it's worthwhile because one of the common symptoms of anemia is very, very tired, exhausted, feeling dizzy, maybe feeling short of breath. Okay, so this dizziness may correlate with the fact that you're having very, very heavy and prolonged periods. Okay, now the other thing is dizziness is known as a side effect. If you go through the literature, if you go through the medication leaflet, you're likely to see that dizziness is listed as a side effect of this medicine. So there are a few things that could be responsible for all of your symptoms, and I think we've covered them. I would think, okay, it's a good idea to go and speak to your doctor. I feel it's unlikely a clot, but like I said, I don't know all of your medical background. So I want you to go and speak to your doctor and explain the symptoms that you're having. Ask them to look at your health condition. Ask them to consider blood tests, for example, to check for anemia. And they can help you find out what is actually going on. But I would also want to say, what are the warning signs? Because we've talked about blood clots, what are the warning signs? Okay, even though we're saying that with this particular method, the Depo shot, the risks are low, but a blood clot could happen to anybody. Okay, pregnancy, the combined birth control pills, these are two factors. There are other things that could increase the risk of people having blood clots. So if you develop sudden shortness of breath, if you develop chest pain, if you notice pain and swelling in one of your limbs, your arms or your legs, it might be red, it might not be, or if you develop a sudden severe headache, seek emergency attention. Okay, so I will say that this bleeding pattern that you've described to us, that you shared with us, let me just pull up the question again. I will say that this bleeding pattern that you described to us is not completely unusual. I'm just worried about the prolonged bleeding that you've described, how heavy the bleeding is, we don't know. You're worried about the possibility of blood clot. Your doctor should address that worry of yours and explain, so that you're reassured, or so that you have tests done that work out what's going on and help you feel better in yourself. So thank you so much, 1010, for sharing that question with us. Really appreciate your time and confidence in putting that through to us. All right, guys, how are you doing? How is the audience doing? Thank you so much for joining. If you're just joining us, we're looking at questions and comments that have come into my mailbag over the last week. You guys know that I share and address questions from viewers because I think it's a great way for us to learn and it helps to build the community. So don't be shy. If you want a question addressed, please share with me in the comments section of one of my videos. We may tackle it on one of these live streams one of these days. Again, that disclaimer that I can't give you specific medical advice. I would always sort of educate and then ask you to go and meet your doctor so you can have the very best of care which you deserve. All right, friends, please give this video a like. Let's take a quick break. I shall be back with you in 2 ticks. Feeling unwell but dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to let me just double check that you guys can hear me. And we shall get on with the show in a few moments. Discreet care that's tailored to your needs. Whether it's a minor illness or just a question that we've got a really interesting case to consider and listen to a few women discussing fibroids, and it was such an interesting conversation. Yeah, the audio was muted. I think you can hear me now because I've taken it off. I've taken it off the mute. So let me just make sure that is working. Let me just give that an opportunity to catch up. Guys, let me know if you can hear. Give me some kind of indication in the comments if you can hear me. I'm not sure. Let me close this and refresh. If I refresh this, I'll see what happens. Okay, I just don't want to keep talking. Ah, okay, yes. So yeah, okay, you can hear me. Fantastic. So let us go on to the very next one. So this is fibroid. So let me release it. Let me share a secret. So sometimes go on to forums. I think forums are quite useful, especially where they are well moderated and where people are respectful. I think you can learn a lot from sharing, perhaps sharing a concern or sharing your experience about a condition, and just removing that sense of isolation that a person might feel with a condition. So I happened to just be browsing one of these forums when I came across a conversation amongst a few women. So it was really somebody who posted her experience with fibroids, and she felt that her doctor wasn't giving the advice or guidance that she thought was right. And so she shared it on this forum and heard from a couple of um, um, people who'd had similar, will I say, who share similar symptoms or a similar condition to hers. Okay, so let me put it up. So let me put you out of your misery. Let me go to the sharing. Is this the right one? Hang on. Yes, okay. So this is the first one. So let me quickly read it out. This year has been hellish with my condition. It started late last year. Let me just take this off so you can see. So she said it has been hellish health-wise. Let's start it again. Okay. All right. So this year has been hellish health-wise. It started late last year when my periods got very heavy and painful to the point I had to use at least 2 good night pads at a time to ensure it doesn't leak. In March this year, I got an ultrasound which showed my fibroids had grown. So she got an ultrasound which showed her fibroids had grown. She had got new fibroids, and now she has 5 of them, with the largest about 7 centimeters, which is intramural. The gynecologist I was referred to put me on birth control to control the period, which just caused me to have more bleeding continuously for 6 months. I've had 2 iron infusions and 2 blood transfusions. I've requested a myomectomy, but the gynecologist seemed to not want to do that, stating because I've not had children yet. So they would rather do a resection, and they can't even guarantee that they will be able to take it out in one procedure. And then she says, but don't I have to be healthy to have children? Anyway, my question is, since I'm in Melbourne, Australia, going through public health, can I insist on a myomectomy to have all 5 taken out at once? Okay, so I hope you caught the flow of the question. I let it sort of stream but while I was reading it out. But I can quickly summarize it for you. And of course, it's not funny in the sense that this is somebody's real experience. So she's somebody who's based in Australia, suffering from 5 fibroids. The biggest one at the moment is 7 centimeters and intramural. I'll explain what that means. Causing her to have severe anemia, where she's had 4 transfusions as a result. She was put on birth control, as sometimes we do, to try and control the bleeding, but it didn't work on this occasion. And the people treating her in the public system are reluctant to perform a myomectomy because they say, well, you haven't had kids, and they're suggesting that she has a resection instead. And she's saying, well, I don't agree with this. Can I insist on having a myomectomy? I want to know what you guys think. Let me know if you're watching, or if you're watching on the replay, if you are faced with this kind of conundrum, if this were you, what would do you think you're entitled, and can you request or just demand a myomectomy? So that's the first person who posted her concern or her inquiry. And what I love was that she got response from different parts of the world. So from the United States, she got a response. Somebody says, I'm in the US and I've only done an open myomectomy for my fibroids and ovarian cysts at the same time. I don't have children either. My OBGYN was confident in my fertility after the myo, if that helps. I tried asking for a second opinion under your insurance until you find a gynecologist who will do a myomectomy. I don't think it's far-fetched to ask for the myomectomy. So that's her opinion. And this person has had fibroids, even had an ovarian cyst, and she had an open myomectomy. She doesn't have kids. And her OBGYN assured her that by having this operation wasn't going to affect her fertility. She could still go ahead to have children. And as if that wasn't enough, we got another commenter all the way from Brazil. So Brazil says, I'm in Brazil and I have 10 fibroids. The largest one is also 7 centimeters. And I've got a 3.1 cm polyp taking all the space inside my uterus as a cherry on top. She says, I am having laparoscopic myomectomy in January because according to 3 doctors, it's the best decision to keep my fertility. There is no way I could get pregnant right now since my uterus is as welcoming to new life as Neptune. None of my fibroids are inside the womb, but they are pressuring the walls. My doctor said after surgery, I'll be able to get pregnant just fine. I would get another opinion if I were you. What do you guys think? So I've just rattled through this comment. I just love the way these women support each other. I think it is amazing how people who share similar symptoms. Now, obviously, it's not exactly the same, but they're similar. But how they share their experiences to just, empower a sister, empower somebody else, share, well, this is happening to me, because we may be in different geographies, right? Under the care of different health systems, but experiencing similar symptoms. Why is one doctor saying this while the other doctor is saying the other? These are the questions to ask. So let's have a look at this. Okay, let's have a look at the considerations here. Okay, before I do that, let me just tackle a few comments. Let me take this image off first and have a look at a few comments that have just come in. So Queenette, hi, says, I was in her shoes. Oh, Queenette, are you talking about the fibroids people? Because I don't know when your comment came in. I was busy reading. And then, Queenette gives us more detail. I did a myomectomy, but after 6 months came back. Oh, and I was trying to heal myself following a nutritionist, and I was pregnant and had a miscarriage. I'm so sorry, darling. Oh, dear. I'm working on myself and eating right. Oh, bless you. Well done. And the fibroid is actually shrinking. My heart goes out to you. Okay, thank you for sharing your experience. And hopefully, as you say, you're working on yourself, and you're getting your nutrition and other things in place. Hopefully, the time will come when your desire to have your family will come. So don't be positive. Many women with lots of really warm, heartful stories, and they got their heart's desire. So I really, really wish the same for you. Okay, so thank you so much for sharing that. Now, so let's look at this conversation that these 3 ladies were having from different parts of the world. And remember that the first lady came and said, she's having horrible bleeding. Then she said, when they did a scan, they found out she had a extra fibroids, which obviously explained why her symptoms had changed. Then they put her on the pill. It made things worse. She had to have 4 transfusions. And then when she now sat down with the doctors to say, right, what are we going to do about this? The doctor says, I don't think myomectomy is the way to go. The doctor felt that it's more appropriate for you to have a resection. So let's clear things up. She mentioned something called an intramural fibroid. And that's why I put this picture up here, because fibroids can occur in different places in the womb. And one woman's fibroid location can vary from one person to the next. Okay, so just very, very quickly, we're looking at an image of the womb. An intramural one is this one sort of at the bottom where my cursor is sort of floating. And that's one that's sitting within the wall of the womb, within the muscle of the womb. All fibroids are coming from the muscle of the womb, okay? But they can differ in the way that they are located. So this is an intramural one. This one is not going to affect your chance of getting pregnant unless it's going so big, it's actually pushing the inner portion of the inner cavity of the womb closed. But it's very, very unlikely to do that. And neither is this other one that's sort of opposite it towards the other side, that's called the subserosal one. Because it's sitting, even though it's in the muscle, it's sort of pushing outwards towards the outside of the womb, towards into the pelvis. Okay, so that one is also unlikely or less likely to cause problems. But what about this one that's sort of on top, that's called the submucosal? You can see how that one, even though it's rising from the muscle of the womb, is sort of pushing into the womb cavity. Now, this is the one that could cause problem with getting pregnant. That's called the submucosal fibroid. So it's really important to, when you're thinking about fibroids, when they say, fibroids, the conversation is not just about how many, it's also about the size and where they are located before you can decide decide the impact in terms of symptoms and other things that they could lead to. Okay, so having talked about that, let us look at, I just felt this conversation and the advice that they were giving, was an interesting one to follow. So they talked about we've talked about the type of fibroid that she has. And so we're now thinking, well, why doesn't the doctor want to do a myomectomy? This is referring to the original poster in Australia, in Melbourne. Why doesn't the doctor want to do a myomectomy? A myomectomy surgery is removal of the fibroids from the womb. Okay, the purpose of the myomectomy is because you want to preserve the womb so that somebody can still get pregnant. That's the and this woman, this is, she wants to do that. But I think what she's saying, what I understood from her, because she said something very, very important towards the end of her note. I want to feel well. Shouldn't I feel well before I get pregnant? She's coming from a place where she's bleeding to the point that she needed to have so many transfusions. You guys are busy thinking about resection and her chance of pregnancy. Just get me well first. And that makes sense. How on earth do you have a good sex drive or libido if you're feeling drained and exhausted and bleeding and bleeding and bleeding, feeling ill? I get her point. It makes absolute sense. Now, myomectomies can be done in different ways. There can be an open one, so a laparotomy where the abdomen is opened, and then the doctors are removing the fibroids. Or it could be done via keyhole surgery or laparoscopy, where small cuts are made on top of the abdomen and they use tools and instruments to remove the fibroids. Okay, and obviously this is the gold standard for a woman who still wants to have children. So what the doctors are referring to, called a hysteroscopic resection, that big name just means that they want to try to approach the womb through the cervix, through the vagina and the cervix, to remove the fibroids. And they're saying, oh, we can go this route because that way it does less damage or harm to the womb, and it still gives you a chance of getting pregnant. And so that in that process, they pass a scope through the cervix to shave away any fibroids that are within the womb. Now, she didn't tell us if she had any within the womb. I presume she has, if they're offering her that treatment. But she didn't tell us. I think she's more focused on that very big, not very big, that big 7 cm. I mean, relatively, 10 cm, those are big ones. But she's focused on that one and worried about the bleeding. But the doctors seem to be more concerned about the ones that she has within the cavity, her womb cavity, and that's what you normally do a resection for. So she's asking, why are they busy worrying about that? Why don't they just tackle all the fibroids, get rid of all the fibroids, do a myomectomy, guys, get rid of all the fibroids so I can feel better. And when I feel better, then my chance of getting pregnant increases. So, we've talked about the importance of location of the fibroids, how it can affect the different symptoms. We've talked about what a hysterectomy, a resection, a hysteroscopic resection means. And so, do I agree with the advice that's been given to her by our sister in the US and our sister in Brazil? Our sister in the US has had her own operation and been reassured that no problem, she's had a myomectomy, she can still get pregnant. Our sister in Brazil is going to be having her own operation, also has a 7 cm fibroid, and has been reassured by 3 doctors that her fertility is not an issue. Okay, so I think it all depends on the location of the fibroids. The doctors are the ones sort of in the best position to be able to say, well, this is what, or this is the most appropriate treatment. However, I'm a strong advocate of a second opinion. I think it's always good to seek, not saying that the other doctor doesn't know what they're doing or whatever, but a second opinion gives you even a rounded approach. And if the first doctor really didn't know what they were doing, then you're better off having the second opinion. But it does give you the opportunity to learn what other option or somebody else might have an approach to do a procedure, and they might be more experienced or better at doing it. The other thing I think is the problem, or is the issue, is the public system. And the public system is one where perhaps you're not paying for this procedure. So it may be that your demands are limited. So for example, here in the NHS, where in the UK, where the NHS provides us with care, it's not that we don't listen to patients' needs or patients' preferences. In fact, that is a very strong point, to listen to the patient's preferences, and provide them with information that they can use to make a decision. So it can be easier, or it can be, yeah, I think the word is easier. If you're paying for the surgery, you can say, this is what I want, and you put your money down. This is in a private setting. But even in a public setting, your choice should be respected. And I think the approach should be, I understand that, you know, my case is challenging because of this and that and the other. However, I do want to preserve my fertility. But my problem is my current symptoms are so severe. I don't feel healthy enough to even consider pregnancy. So let's tackle that. Can you refer me to a gynecologist who perhaps specializes in fertility sparing fibroid surgery? That's the kind of conversation to have. And then you've got evidence from people in other parts of the world saying they've had these and, you know, this, they've been successful. So your request is not unusual. It's not abnormal. It makes absolute sense. And myomectomy is the standard, you know, of care for women who want to have children. We have different guidelines from across the world, both in Australia, in the United Kingdom, in the US, and so on. So I will, you know, sort of add my voice to the ladies who are saying, you know, go for a second opinion. You know, when you go to sit down with your doctor, make sure prepare yourself ahead, get your list of symptoms and how they're impacting your life. Example, these transfusions, perhaps you're not able to go to work or school or whatever the case may be. Look after, you know, whoever you're in charge of looking after, or, you know, whatever things you're doing, or you're taking time off work and so on. Discuss your fertility goals, you know, and the positions, what you've heard from other people. I think that's valid. And, you know, ask the doctor, is having a hysteroscopic resection, is it possible with this intramural fibroids that you have? And if it's not, why am I not being offered a myomectomy as the primary option? And see if you can get answers. So I thought this was an interesting conversation. I think what was the greatest for me was the input from sisters from different parts of the world. Shout out to those who use forums. Again, make sure it's one that is moderated, where conversation is respectful. Be careful, because sometimes not all the advice or information you pick up there is accurate. So always double check with a qualified medical practitioner that you check. But I do think that place where you can share experiences, you know, ask questions from people who share, you know, who have similar experience to you, can be so helpful and fulfilling. Okay, guys, thank you so much. Oh gosh, I hope that you found that interesting as I did. Let's just see. Let's catch up. Let's catch up with our chat. I've got best junkie, my favorite meal. Oh gosh, I don't know what we're talking about. Favorite meal. Okay. And Queenette is saying, right? It's Queenette. Somebody says, Madam, how can I solve my migraine problem? Good question. And Queenette said, had an HCM, which was in my womb. Yeah, I can just imagine. All right, guys, thank you so much for the comments. Thank you so much for joining in. Please give the video a like if you're finding it helpful, finding it useful. Much appreciated. Okay, so we've got one more case to cover, and this is actually a question that was posted into the channel. So let's tackle that one straight off, and I think you're going to find it interesting. Let me pull up the question. It's not a very long one, actually. Let me pull it off. So this person says, if someone has a very low CD4 count, can they remove, or can they have genital warts removed with surgery? Or should they wait till their immune system gets stable? So I know this is, you're craning your head, because we've gone in so many different directions today, haven't we? We started with abdominal pain. We went towards Depo shot injection and side effects. We've just come away from discussing fibroids. Now here we are with genital warts and CD4 counts. Okay, so I think this was really a really interesting and important question. Thank you so much to the person that posted it. Before I put that here, I think a comment just came in. Let me take it, because it'll take a while before I come back to comments at this point. And so Queenette, okay, Queenette was saying, oh wow, I was told to do a hysterectomy, but I refused and did myomectomy. Fine. I mean, I think it's best to do what you feel works best for you, and we're all different. The most important thing is getting the information that you can use to make your decision. The doctor said she doesn't want me to try getting pregnant because I bleed a lot. I always feel when you're hearing something and perhaps it's not perhaps it's not making sense, or it's not making too much, you don't understand too much where the basis of the information is, a second opinion is helpful. So she said, I didn't see this. I was just saying, responding to your last comment. And then Queenette says, I changed her and started with another doctor and I'm getting better. So you've just really demonstrated real life what we're saying, that it's not, there could be different viewpoints. And there could be different experiences from the doctor. And I think it is reasonable to, go in a different direction. And it is worth it. It's your life, it's your body, it is worth it. You also had 4 transfusions. I'm pretty sure it's not your case that we're discussing, Queen. So thank you so much for sharing. I really appreciate that you're validating what we're saying and showing that it's true. Thank you so much for sharing your experience. All right, guys. So let's crack on with this. Let's crack on with this case that we have here, which is dealing with warts. We've gone through the question, and the question is a very simple, straightforward one. This is somebody with low CD4 count, so somebody with most likely who's been diagnosed with HIV, and they have low CD4 counts, and they also have genital warts. So obviously, this question was on the back of one of my videos on genital warts that this question came up from, and you're looking at, sorry, let me put the image back. You're looking at different types of warts. I just thought it was useful just to put an image on the screen so that we know what we're describing. So warts can appear in different shapes, sizes, colors, and so on and so forth. And they can really appear anywhere in the body. The genital ones are obviously the ones that happen around the genital area. And so this question is around the treatment of genital warts. And the complication here is that they have a low CD4 count. So let's address this, because what they want to know is surgery, which can be used to treat warts depending on the type of size of warts and symptoms it's causing. There's obviously medication treatment, even freeze treatment is other options. Like I said, I have 1 or 2 videos. I think there's one really maybe 5-7 minute video. I talk about what treatments specifically. So if this is something that you really want to learn more about, please go and check out that video on the channel. Okay, so I think it's a really important question. Let's break it down. So surgery is for the purpose of removing the wart. It's not going to do anything for CD4. Clearly, it's about the wart. Okay, now I am not your medical provider. So this disclaimer is to say I cannot say specifically what you should go and do. I do think that with this question, you should be speaking to your specialist, so that whether it's both your hematologist as well as your sexual health specialist, and have conversations, or your family practitioner if you've not been referred to sexual health because of the genital warts, okay? Because I think this is something that a decision that should be made in close consultation with your HIV specialist, and your whether it's your GP, your family doctor, or whoever is looking after the genital warts. But generally, the important thing, what should guide us, is stabilizing your immune system. Okay, so genital warts are caused by the HPV virus. So at this point, we're tackling 2 different viruses. Let's not get it mixed up. There's HPV, human papilloma virus, that's responsible for causing warts, okay? The genital warts in this case. Now, if you have a healthy immune system, if you watched my warts video, because I'm sure I mentioned it, if you watch my warts videos, you will hear that up to 1/3 of warts actually can be cleared within 2 years, within around that time. Now, clearly, depending on how big the wart is, how it looks, and so on, people may not want to wait 2 years for their body, their normal, healthy immune system to clear the warts, okay? And so then you have treatments, different creams, different preparations, like a freeze therapy that you can apply to the warts to treat them. So a healthy immune system can actually clear the warts. But a low CD4 count means that the immune system is not well. It's not very well. It cannot cope, basically. So if you go ahead and do surgery when your immune system is not good, you may remove the warts that you can see, but your immune system is bad, within a few months, that wart is likely going to grow bad. When I say the immune system is bad, I mean it's not well, it's sick. So the warts might very well go bad. And so the surgery was useless. So that's why you need a healthy immune system in the first instance. Now, the goal of HIV treatment is to build your CD4 count up, and that's why you're treated with antiretroviral therapy or ART, which what it does, it suppresses the HIV and allows your body's natural production of CD4 cells. CD4 cells are a type of your white cells, your body's defense mechanism. So it gives that, by suppressing the HIV, the antiretroviral therapy allows your CD4 cell count to go up. So when your immune system starts recovering because you're taking your treatment, your body can even start clearing the genital warts, that's the HPV virus on its own. And it might be that it completely clears the warts. You may not even need to have surgery. Okay. Now, the other thing, like I said, if you go ahead to have surgery while the immune system is sick, possibility of getting the wart back is very high. But the other thing, if you have surgery while your CD4 count is low, is you need your immune system to heal after surgery, essential to heal after surgery. So having a low CD4 count can mean that your healing is slower. There's a higher risk of serious infection, not just at the surgical site, but even serious infection that could make you very ill, that could even be very seriously complicated or fatal. I mean, it's good to just sort of think broadly around these things, or scars can develop because of a poor healing process. And then the other thing is, it's the procedure, so it's like a waste of time, because if the warts are likely to get better without surgery, simply because your immune system is recovering, why go through surgery? It's good to think about surgery. It's not without its risks, even though, hospital systems have become so much better at dealing with surgery, preventing complications. But why go through the risk if you don't particularly need to have it? Okay. And surgery means you're preparing yourself, taking time away from what you would normally be doing. It has so many things to think about. Okay. So what could your doctors be typically, what might they suggest to you when you go and sit down with them? They would most likely want to get on top of the HIV. They want to make sure that your CD4 count comes up with a very effective antiretroviral treatment, that's ART regime, okay? I think that's the most important. I think your doctors will agree, but I think you should go and have a conversation with them. And then while you're waiting for the count to go up, what can happen? Now, the warts might be causing you symptoms, so they may make you uncomfortable. Warts generally are not painful, but depending on where they're located, they may be uncomfortable, they may be itching, or you may just feel very uncomfortable with them. Fair enough, I'm not disregarding that. Okay, but like I said, they're non-surgical methods, non-invasive methods that can be used. Depending on your body, your medical history, you should have that conversation. In my video, we talked about creams like imiquimod, we talked about podophyllitoxin. You need to have a conversation with them to make sure these are appropriate. I'm definitely not recommending them. I'm just mentioning them as some of the non-surgical methods that we have that could be used if thought suitable with your condition and with any other treatment that you're getting. So once your CD4 count has improved to a level that they think you can cope with surgery, they can now reassess the symptoms and decide, right, the warts haven't gone, the other treatment that we've used, it hasn't helped. That is the time then surgical removal can be considered as a more effective and low risk option at that point. But at least your CD4 count has improved. And by that point, the chance of recurrence or the wart coming back is a lot less because your immune system is healthy, is recovered. So what is my takeaway? Please speak to your doctors. I feel it makes sense to wait because that was your question. Where's your question again? Let's make sure that we've addressed it for you. If someone has a very low CD4 count, can they remove genital warts with surgery? Should they wait? I think it makes sense to wait till your immune system is stable, my love. That's what I would suggest. And alongside that, I would say, please go to your doctors. They know your medical background. They know your history. They would want your body to get back to a state where it can help itself so you can heal better. And surgery itself does not cause complications for you. My goodness, have we not whistled through this? Guys, thank you so much. I think we've done an amazing job. Thank you so much for your company. I want to thank my special guests in the comments today, particularly Queenette, who spent time with us, shared her experience, who popped in. Looks like she was here right from the start, I think. Queenette, thank you so much. I don't know if you're still on the stream, but thank you so much. I appreciate that. And thank you for everybody else who popped in a comment or a question. Very much appreciated. Guys, first live stream of the last month of the year. Welcome to December. Thank you so much for your time. Please don't forget to give this video a like. And friends, that will be much, much appreciated. And of course, if you are based in the United Kingdom, looking to see a private GP with years of experience in looking after women's health, sexual and reproductive health, and of course, general medical issues, please come and visit us at yourgpconsultation.com. You can use the QR code that is showing up on the screen to do so. So I am going to say thank you so much again for watching, and I will see you again in the next one. Check out the videos that we're doing. I'm doing Vlogmas for a few days this Christmas for the first time. Please support me. I think my first video might come out later tonight. So please support me by watching it. And of course, let me know if you've got any questions. Thank you so much, guys. I'll see you again soon. Bye. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today.